the next 7 days. Next shot of showers comes on Thursday. Rob?
Mike, thanks. As we continue to rebound during the COVID-19 pandemic, we've spent the last several weeks looking at ways to manage our mental health, but adults aren't alone. Our kids also battling anxiety and depression. News 5's Patrick Nelson spoke to experts about how we can help children cope with these challenges.
For just about all of us, this year has not gone as planned. Isolation, changes to the school year, financial stress, canceled plans. They're all things that adults struggle to deal with. But it's also having an impact on our kids. Experts say it's something we need to recognize.
Exposed to the anxieties and fears that their parents are experiencing, they're having to go through some really adult topics right now.
Dr. Krista Bridgman is a former school counselor and professor of psychology at CSU Pueblo. She urges parents and other trusted adults to pay attention to signs of stress and anxiety in youngsters right now.
They're teetering into an age where you're old enough and mature enough to understand some things, and you're old enough and mature enough to not understand some things right now too.
Here are some of the signs to look for in younger kids. Experts say they may be more tearful, irritable, or even more clingy than normal. For the older kids, pay attention to changes in moods, irritability, isolating themselves, changes in weight, and sleeping for long periods of time.
Anytime parents can socially and safely expose their kids to an environment where they have some face-to-face interaction, as long as it's done safely, will be really helpful during this time.
Here's some other ideas of things you can do at home to help. Have periodic check-ins with your kids, ask how they're feeling, and then validate their feelings. Come up with a plan for the day or week and share it with them so they know what they have to look forward to. And consider creating a family bucket list of things you can do this summer that you haven't done in the past. One of the biggest concerns for people in the mental health field when it comes to kids is how they will be supported once they head back to school in the fall.
Do we have enough school counselors? The American School Counseling Association recommends one school counselor to 250 students. The state of Colorado is not there. And that number was very difficult before coronavirus. And now we're going to have a lot of kids that normally wouldn't seek the assistance of a school counselor are now going to be seeking the assistance of a school counselor.
Dr. Bridgman says she hopes schools are looking at options right now.
All of our schools are going through a crisis. Our kids are going to need those services, especially in the beginning, reacclimating back to school.
For parents who would like to seek professional help for their kids, you should talk to your primary care doctor first. In most cases, that'll be your child's pediatrician, and at that point, the doctor can then refer you out to a psychologist or therapist if needed. Always watching out for you. Patrick Nelson, News 5.